come in.
Hi, Ms. Jones. My name's Taylor, and I'll be your occupational therapist working with you today. How are you doing?
I'm doing good. How are you?
Good. So your doctor has ordered occupational therapy evaluation for you to address the symptoms that are keeping you from fulfilling the daily tasks that you want and need to complete.
Okay.
But before we begin, can you tell me today's date?
December 13th, 2015.
Good. And can you see the clock up there on the wall and tell me what time it is?
9:40 a.m.
Great. And have you had any surgeries prior to this hospitalization?
I had my tonsils removed.
Do you remember the year of that?
I think it was 1990.
Perfect. And can you tell me a little bit about why you're in the hospital today?
I had a heart surgery.
Good. I see in your chart that you're to follow sternal precautions. Are you aware of those precautions?
Yes.
Great. And I also see that you're experiencing some swallowing difficulties and your blood pressure drops upon position change. So we'll try and move slow and gradually to avoid any of those symptoms from reoccurring and to prevent you from getting too short of breath. Does that sound fine?
Yes.
Do you have any pain right now?
Just a little, maybe like a 4.
4 out of 10?
Yeah.
Okay. So in your chart it states that you live with your husband in a first floor condo. Are there any stairs to get into the condo?
No.
No. And you have a dog?
Yes.
Do you care for the dog? Does your husband care for the dog?
We both do. We just kind of, whoever's available, just kind of take him out or feed him.
Okay, great. Now around the house, were you pretty independent before? Were you able to do mostly everything by yourself?
Yeah, I was pretty independent. My husband does some things, but I like to kind of do for myself.
Okay, great. Now after this surgery, you're aware that you'll need to take things slow and ask for help when you need it, even with things that you were independent with before.
Yes.
And does your husband work?
No.
Okay, so he should be available during the day to help you throughout the day with things that you won't be able to do by yourself anymore.
Yes.
And are you planning to go back to work eventually?
Yes, I would like to.
Okay, good. As you know, my job is to get you back to your prior level of functioning, which you said was all independent. So let's go ahead and take a look at how your muscles and joints are working. Do you mind sitting up on the side of the bed for me?
Sure.
Okay, let's see. Can you raise your arms straight up out in front of you just like this? Good, and can you show me how you would bring your hand to your face to brush your teeth? Good, and let's see. Now can you squeeze my fingers as hard as you can? Good, so that left hand is a little bit weak. You can go ahead and lay it back down. So to get you back to your prior level of functioning, we'll need to work on your strength and mobility in your left arm and hand so that you can become more independent with the use of that arm. We'll also work on your coordination as your stroke has impacted your ability for that arm to be functional. That way you can complete self-care activities that you did prior to your surgery, including showering, grooming, and dressing. And to address these goals, I'll be seeing you in the mornings to address your morning routine self-care tasks. So when I'm not working with you in therapy, I think it would be a good idea for you just to be, kind of doing some things on your own, practicing squeezing something, maybe like a tube of toothpaste, to bring back your grip strength a little bit, and that will help with basic ADLs, so again, grooming, dressing, things like that. The sooner we can regain your strength and range of motion, the sooner you'll be able to return to your prior level of function. Let's see. So I see that you're left-handed, and you'll probably struggle a little bit with your right hand, since that's not your dominant side, I'll let your nurses know that you're trying to gain independence, but you're having difficulty with that left arm and hand. And for meal times, they'll provide you with build-up utensils, making it easier to grasp with your affected hand. And I'll make sure that they know to help position you, so that you can more successfully feed yourself.
Okay.
Now, when you leave the hospital, where are you planning to go?
Home.
Back home, okay. And we'll probably provide you with adaptive equipment, necessary for you to be as independent as possible until you recover. I see that you also requested for a hospital bed to be delivered to the house until you can get up, without the head of the bed elevated. And then I wanted to ask you, Ms. Jones, to address any balance concerns you may have, would you also like to have a rolling walker delivered to the house?
Sure.
And that would just make it easier for you to get around when you first get home, but you can get rid of it as soon as you feel comfortable. But I think it's a good idea for your safety when you get home. I also think it may be beneficial to look into support groups for individuals post-stroke. They'll provide support and can assist you with any feelings you may be experiencing or questions you might have regarding your stroke itself or your recovery process. Does that sound like something you'd be interested in?
Sure.
Yeah. And to continue seeing improvements once you're discharged from here, I think it would be great for you to continue OT, to work on your strength and range of motion in the left arm. Generally, clients from here, we send them to the outpatient facility down the road, but because you won't be able to drive, will your husband be able to drive you to those appointments?
Yes.
Great. Well, I look forward to working with you, and have a good rest of the day. I'll see you tomorrow.
Thanks. You too.
Thanks.